So what is the criteria to select level just based on time? Yes, we all know that we can assign level based on MDM or time alone in 2021. So the same criteria till now we are following, but we are following time or key components to assign the level. But in 2021, there is no requirement of key components. Only MDM is required to assign the level of service or time is required. So what are the changes made under time? We'll have a look. Yes. So the activities that can be included for time calculation must be performed on the date of encounter. So we are considering only time based on the encounter, only for the date of visit by the physician or other qualified healthcare professional. The physician may be a same physician, means same group practitioner, or by the other group practitioner. The physician may be any physician, but only thing, the date of encounter, he has to perform the activities. So what are those activities? We'll see in a next slide. So before going to have a look on time activities, so I would like to discuss you some more important points regarding time. Okay. Yes, you will be able to use time alone to select the correct code only for 99202 to 99205 and 99212 to 215. So the next point is an important point which is applicable only for these codes. So till now what we know the concept in assigning a level of service. So the total time should be documented. Out of total time, the 50% threshold should meet for the counseling and coordination of care. Then only we can assign a level of service. But for these codes 99202 to 205 and 99212 to 215, the time criteria will have some change. So what is that? So counseling and coordination of care will not need to dominate an office or other outpatient E&M service for you to code the service based on time in 2021. Means the 50% threshold is not required to assign a level in 2021. For remaining services, the concept will remain same, only for office visits. Excuse me, 202 to 205, 212 to 215. This change is applicable. Okay, you can remember this one, and don't apply for all the services, just apply only for the office visits. So you will use 99211 if clinical staff members perform the face-to-face time or face-to-face visit under the supervision of a physician or other qualified healthcare professional. Yes, to assign level of service, we need face-to-face time. Without face-to-face, we are not going to assign, or we are not going to consider under category. Okay, a key shift for the office or other outpatient E&M codes is that the time referenced in the 2021 code descriptors is total time. Yes, so to assign a level based on time, we need total time. Yes, so what is the criteria that we can consider as total time? So total time means the time which is considered both face to face and non face to face activity. So what is the time spent by physician with a direct patient contact? That is nothing but face to face service, and with a indirect patient contact, which is nothing but non face to face. So the total time includes both face to face and non face to face. Okay, so what are the different activities which comes under face to face and which comes under non face to face? We'll have a look in a next slide. Okay, I will give clarity which comes under face to face, which comes under non face to face. Yeah, so the total time also will not include time for activities the clinical staff normally performs. So this point we need to remember. So what is considered as total time? Only the face to face and non face to face time performed by the physician only. So the regular activities which performed by clinical staff is not considered as total time. Okay, we need to remember this point. When you start counting time for the 2021 codes, you should not include time spent on services you report separately. So this is also an important point that you need to remember. If any service is going to report separately, what are the time spent by the physician towards that procedure is not counted under level assignment. Okay, for instance, if you report care coordination using a separate CPT code, you should not include that in the time of the E&M code. Okay, so 2 points that we need to remember. So total time is not included performed by clinical staff which is normally performs, and separately reportable procedure service which the physician spent some time to perform that procedure is not included in E&M code. Okay, so next point is the guidelines offer the examples of preparing for the visit, such as reviewing tests, getting or reviewing an history that was separately obtained because no longer physician is required to document history and physical exam. Okay, so performing the exam, counseling and providing education to the patient, family or caregiver, ordering medicines, tests and procedures, communication with other healthcare professionals, documenting information in the medical record, interpreting results and sharing that information with the patient, family or caregiver, and care coordination. Yeah, so now we'll have a look about what are the different activities included in time. So we can consider to divide into two categories. What are the different activities means? One activity comes under face to face, another activity comes under non face to face. So if you can observe clearly, so what all comes under face to face? Yes, the perform will comes under face to face, nothing but performing a medically appropriate examination or evaluation without seeing face to face, a physician to patient and patient to physician. There is no performance of physical examination. So physical examination comes under face to face time. Counseling and educating the patient, family, caregiver, that comes under face to face time. Consult, referring and communicating with other health professionals. So even the physician from other practice, other group practice also, without being seeing the patient, he cannot perform his evaluation. So the consult is also considered as face to face. And care coordination not separately reported, but still that is considered as face to face time. Okay, so what are the points, activities that we can consider under direct face to face? Perform, counsel, consult, coordination, all this comes under direct face to face time. So what all comes under non face to face time? Preparation, so preparing to see the patient reports, example review of test. Okay, here patient is not required, so there is no any face to face contact, so physician spends some time just to review the report which is related to the patient, that is considered as non face to face time. Okay, so review, obtaining and are reviewing separately obtained history. So still here patient is not required, so physician can go and review the reports from a independent historian. Okay, we already know who are independent historian, or patient can go and get information from other sources. Okay, here patient is not required, so this also comes under non face to face time. So ordering of test, ordering medication, ordering for procedures, so still patient is not required, this is considered as non face to face time. Okay, documentation, so documentation, what are the problems addressed during encounter, so what is the data documented under during the encounter, and what is the risk identified during the encounter, all should be documented. So still patient is not required, so this is considered as non face to face time. Independently interpreting results, so sometimes maybe patient is required, but most of the time physician alone or any other physician together can discuss and interpret the results. So here also patient is not required, hence this is considered as non face to face time. Okay, these are all the total activities which is considered for time selection. Okay, face to face and non face to face. So I hope I am making sense to everyone. So with this we are moving to the level assignment, means code assignment based on time for the new patient.